Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Bonnie Henry, Dr. Bonnie Henry, the Provincial Health Officer. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, the briefing will be at 3 o'clock. On Saturday, it will be at noon. On Saturday, it will be only Dr. Henry. And then on Monday, we'll be back again at 1:30 and then 3 the remainder of the week. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. For our update today, we have an additional 55 test positive cases here in British Columbia, bringing our total up to 1,121 people who have tested positive for COVID-19 here. That includes 525 people in Vancouver Coastal Health, 386 in Fraser Health, 72 on Vancouver Island, 121 in the Interior Health Region, and 17 now in the Northern Health Region. In addition, we have an additional community outbreak related to an inmate at the Okanagan Correctional Centre in the Interior Health Region. And this is, of course, something that we have been concerned about and planning for. There was a number of measures put in place to try and reduce the risk of introduction of COVID-19 into all of our correctional facilities, both the provincial ones and the federal correctional facilities across the country. There has been an active surveillance program, and this is the first test that has been positive in a facility here in British Columbia. As people are probably aware, the Provincial Health Services Authority has taken over the health services for our correctional facilities across British Columbia a number of years ago, 2 or 3 years ago. So PHSA, Correctional Health, and Interior Health have been actively managing this outbreak since we were notified yesterday evening. In addition, we continue to have the 21 long-term care or assisted living facility outbreaks that are actively being managed both in Fraser Health and in Vancouver Coastal Health. Currently, we have 149 people hospitalized with COVID-19 in British Columbia, and of those, 68 are in the ICU or critical care areas at this time. Sadly, we have had an additional 6 deaths over the past 24 hours in British Columbia, bringing the total number of people who have died to 31 here. That includes 3 additional deaths in Vancouver Coastal Health related to 2 of the long-term care facility outbreaks, 1 in Fraser Health, and for the first time we've had 2 people who have died here on Vancouver Island. Both of them here on Vancouver Island. So we obviously put out our condolences again to the families, the care providers, and the communities who will be missing these additional people. We have now, on a positive note, 641 people who have fully recovered and are now out of isolation from COVID-19. So this has been, as I've said every day this week, it's a challenging time for us. It's a challenging time across the province. We're in that phase where we need to be incredibly careful about what we're doing. We need to continue to take these actions that we've asked you to take and we've directed you to take over the last 3 weeks. We now have more than 1 million cases of this disease worldwide. We know that there's a dramatic ongoing outbreak in the United States, and across Canada we're seeing increased numbers of cases, particularly in our communities in Toronto, in Ontario and Quebec. We have now over 1,100 cases here in BC, and it is growing. The number of people who are hospitalized is also growing. Although thankfully by a small amount. And that, I truly believe, is part of the reason that we are seeing the growth in a manageable way here in BC is because of what everybody is doing together. And that it remains the important thing around physical distancing that we can all do, and allowing our public health services and our healthcare workers to focus on focus on the people in our long-term care homes, to focus on our hospital settings, to ensure that we can identify and rapidly respond to outbreaks in our communities, to try and stop those transmission chains. Part of this, of course, is making sure, without exception, that people who have come into BC from around the world are immediately complying with the orders, the federal quarantine orders and our provincial orders to self-isolate, to quarantine for 14 days. One of the things that we do know is that there will be some people from British Columbia who will be flown home from one of the additional cruise ships, the Zandam, that's apparently going to be docking very soon in Florida. And we've been in contact with our counterparts at the federal government to ensure that they are appropriately assessed when they come back and that they are actively managed in quarantine. We know that these are such a high-risk setting and that we have had people returning to British Columbia from other cruises who have developed COVID-19. And we need to be very careful to support these people so that they are able to effectively isolate and that we have no transmission should anybody become ill. I also want to talk a little bit about some of the things that we've been asking people to do and requiring people to do in British Columbia around non-essential travel. And there are many of our smaller communities that are very concerned about people coming to vacation homes, to fishing lodges, etc. And I am asking people now to forego those types of travel. All non-essential travel, particularly to smaller communities where we might not have the resources to support you should you become ill or should there be transmission in those communities. And that's a really important thing that we need to do now to protect those who are more vulnerable in those communities, particularly our seniors and our elders in our small and remote communities around the province. In addition, we know that there's a very important time coming up for many people of different faiths. We have a number of religious celebrations coming up in the next 2 weeks, including Easter, Passover, Ramadan. So there are many faith-based celebrations that are happening. And I want people now to start thinking about what we can do to support people in practicing their faith without having to have in-person gatherings. And I know many of the faith communities have been doing this already and have been particularly supporting elders and seniors in their community to make sure that they can safely participate virtually, in many cases, in these important religious ceremonies. And there is no more important time than when a community is in crisis, as we are in BC, to make sure that we can do these types of important ceremonies in a safe way. So we need to use the many tools that we have available now to connect with followers in other ways than in person. And we'll be talking again with our faith leaders next week to make sure that we can all do this and share ideas about how to support each other in a safe way. We are getting through this, and we will, of course, get through this together. And I am, again, very heartened by the fact that across this province, people are taking the important actions that we are asking them to take, and doing that in support of each other, in physical distancing, and we are standing united in that in a virtual way. We're working together to keep that firewall strong, to make sure that we can prevent the transmission of this disease as much as possible. We need to continue to follow these orders and precautions that we have in place. We must do all we can to protect our families and our communities across British Columbia.
Thank you very much, Dr. Henry, and I'd like to join Dr. Henry in expressing condolences to the families of the 6 additional people who've died subject to or as a result of COVID-19 in British Columbia. We know what contribution they know. We know what kind of day this is for their families, and we wanted to express our condolences to their family, to their caregivers, to their friends and their communities. As you know, 31 people now have passed away in British Columbia from COVID-19, 24 in Vancouver Coastal Health and 5 in Fraser Health and 2 now in Island Health. And in every single case. We know what that means, what it means to us, but especially what it means to their families and their communities. And so we wanted to express that thought on this very sad day for them to say that every single person, we sometimes stand up here and talk in terms of statistics and the implications of it, but we know what it means for every single person, and certainly to us, every single person counts. I wanted to just reflect it's 1,121 cases of people who've tested positive for COVID-19 in BC. 149 of those are in acute care, and that's 65 in Fraser Health and 61 in Vancouver Coastal Health, 10 in the Interior Health Authority, 8 in the Vancouver Island Health Authority, and 5 in the Northern Health Authority. 68 of those are currently in ICU. That's up from 67 yesterday. And there are 4,273 empty and available beds in BC across the 5 health authorities, the 6 health authorities, I should say. And that's a 60.2% capacity currently, and 55.4% in critical care. Both of those numbers are stable. We also wanted to say, just to describe what's happening in the healthcare system today, that we had on April 1st 3,039 emergency room visits in BC. That's down from March 9th when that number was 6,559. It tells you a little bit about what's happening in BC society. We also have significantly fewer overall ambulance calls. The number of calls we've had in the last week from March 25th, where we had 306 calls, ambulance calls for influenza-related questions, which would include COVID-19 questions. That's now, in the most recent day, down to 264. I want to talk briefly about long-term care and about what's happening at the Lynn Valley Care Home, at the Harrow Park Care Home, and at other care homes across British Columbia, and how significant it is and the actions that have been taken. As you'll be aware, the provincial health officer and health officers across British Columbia have taken the direction that we need to move people to a single care home to work at, and that work is ongoing. It involves many thousands of people, and obviously consultation with both their representatives, the affected unions, including the Hospital Employees Union, the BC Nurses Union, BC Government Employees Union, and other unions on the union side. The Health Employers Association, HEABC, of course, and organizations such as Denominational Health, the BC Care Providers, and others. And those discussions are going on. We'll continue to keep you informed as to how that goes. Clearly, it's our view that when workers have to make a choice, should they make a choice between multiple sites and one site, that workers would be kept whole. There's a lot of discussion to take place in that, and a lot of work to happen on the ground involving thousands of workers. Care homes are obviously of great importance in what we're doing. As you know, in our testing strategy, there's been an enormous emphasis on healthcare workers in order to protect both them and protect residents and or patients, as the case may be. Significant procedure changes have been made, restriction on visitors, that everyone involved in long-term care who has somebody or knows somebody who has a dear family member in long-term care is well aware of all of these. Our goal is to ensure that both healthcare workers and long-term care are supported, and that residents and workers are protected to the maximum extent possible from COVID-19, given its potential effects on people in long-term care in particular, effects that we've seen reflected in what's happened at Lynn Valley and Harrow Park and other places. I want to speak briefly about PPE. We're taking very significant steps on this question to ensure that healthcare workers are protected, that they have the appropriate PPE. We're very encouraged by the Prime Minister's announcement this morning that the federal government has had success in sourcing PPE. Their success is our success. This is good news for BC. It's good news for every province. And we're working closely with Canada and our provincial partners, territorial partners, to coordinate the allocation of this PPE. We're also putting a very significant effort in sourcing PPE ourselves. We are receiving supplies on a regular basis, and as supplies come in and as large supplies come in, whether it be through the federal government, who is taking a leadership role in this, or ourselves, we'll continue to let you know. And so I wanted to just finish by saying that, by reiterating what Dr. Henry said about unnecessary travel. This is not the time. It's just not the time to travel to travel for tourism purposes within British Columbia or anywhere else. This is the time to stay close, to stay home to the maximum extent possible, to only go out for essentials, whether it be to work or for other things. I think and especially I want to say this, for returning travelers who've been away, they're coming home to a very different place, very different Canada, a very different BC. We know now that because COVID-19 is spread by droplets, the greatest potential source of infection is loved ones. So by following the rules of self-isolation, you are protecting those that you love. There is no better reason to follow the rules Dr. Henry has given you. There are rules that protect your community. There are rules that protect your friends. There are rules that protect your family. And there are rules that protect the ones you love. And we need, as always, 100% of people to follow rules, especially those who will be returning to Canada in the days and weeks to come. Thank you very much. We're happy to take your questions.
Okay, so a few housekeeping items. Please press *1 to enter the queue. You are limited to one question, no follow-ups. I would also ask that you unmute your phones. You will not be audible until we call your name. First question today comes from Justine Hunter at the Globe and Mail.
Thank you. I feel like I won the lottery getting in the queue. We're asking healthcare workers to face increased risks right now, and I'm wondering if you can bring us up to speed. Will BC be paying their salaries if they need to be in isolation, or will we be providing accommodations so they don't have to worry about putting their families at risk?
So the short answer to that is yes. There are a number of provisions that have been in place and will continue to be in place, and we are looking certainly at accommodations for people who need it, who have people at home who are more likely to have severe illness from COVID-19, and ways of protecting them. And you know, as this builds up in our hospitals and in our ICUs, people are getting stressed, of course, and anything that we can do to try and alleviate those pressures, even the little irritants, some of the irritants like parking and pay parking. So yes, we have measures in place, and we'll continue to do that to support all of our healthcare workers.
Next question comes from Shrushti Gangda of CKNW. Go ahead.
Hi, Dr. Henry. With a confirmed case at a correctional center now, you said that was a point of concern before it happened. What protocols are you looking at to prevent spread in the jail, given they have, shared facilities and it's hard to social distance in a correctional center? And a lot of people have been calling for nonviolent offenders to be released. Is that something that BC is looking at?
So yes, we've had a plan in place from the beginning. This was one of the, we talk about some of the areas that we want to do enhanced surveillance, make sure that we can detect things early. Long-term care homes are a case in point. Other closed environments, some of the more remote communities, for example, and definitely correctional facilities has been on the radar screen from the beginning. So there were measures that were put in place some weeks ago, restricting visitors and doing health checks and making sure that there was rapid access to testing should people become ill because of the communal setting. So this was in place, and there was measures in place as well for new people coming into the facility to be isolated for 14 days. So there are things that we can do in those facilities to help support this. The person who became ill was isolated, and the people in the pod that he was in are all being monitored now. So far there's no other cases, but it takes time, as we know, after an exposure where people can develop this disease. So ongoing outbreak protocols are in place. It's always challenging in these closed environments. So I know the corrections team from PHSA and Interior Health are working on this even as we speak. In terms of nonviolent offenders being released from correctional facilities and from detention centers, that is an issue that's with the Minister of Public Safety and the Solicitor General.
Okay, next question comes from Melanie Nagy, CTV.
Hi there. There was a lot of talk today at a federal level with the Prime Minister regarding modeling. We know that you walked us through some great data last Friday. Part of the responses from different federal authorities is that they are still collecting information from different provinces to put together their data, to put together their modeling to share with people. What are we sharing with the federal government? And would you like to just see more of what you're sharing at a federal level?
Yeah, it's an evolving thing as well. There's a number of groups of modelers across the country, and I think I've talked about this a little bit before. And there's many different types of models, and we presented two. We have other types of models that we're also looking at that help us give a sense of where we're going on our trajectory and whether one intervention or another might help if certain situations happen. So that modeling is, and the reality is that the models are only as good as the data that we have. And of course, we didn't have much data until everybody started to have more cases. And as we have more cases, there's more work that public health has to do to get the information on each individual case. So when we had our first cases, we had a 15-page case report form that we collected all the detailed information and transmitted that to the federal government, and they put all the stats together. So as you can imagine, we now have at least over 1,100 people that public health is following up with on an ongoing basis. So we've now streamlined that to a much smaller set of information because it just isn't physically possible to provide all that information on an ongoing basis. And so that's one of the challenges, particularly for Ontario and Quebec that have rapidly increasing numbers in a very short period of time. So we are negotiating, if you will, to have we've been working with them on defining a smaller set of information that provides what they need to be able to do the country level projections. But I think the other thing that's really important is we don't just have one pandemic wave coming in this country. And when we've been involved in doing the Canadian pandemic influenza planning, which I have for a long time, we've recognized that in a country that's as large and diverse as Canada, that things happen at different times. And we've certainly seen that. So our pandemic is going to be quite different from Ontario's pandemic or Prince Edward Island's pandemic. So we need to keep that in mind as well. And that's been one of the challenges at the federal level in having a model that describes what's happening across the country. So we have been sharing our information with them. And other provinces as well. We've all use slightly different things sometimes, and the modeling support from the federal government has really gone to some of the provinces that don't have the resources that we in Ontario and Quebec have as well, which is kind of a long answer. I'm hoping next week we'll present our models again and show you where we are in the trajectory that we've used, and so I look forward to sharing more of the information that we can.
Tanya Fletcher, CBC.
Yeah, we're getting complaints from people still about them saying their neighbors have returned from travel but are not self-isolating. And specifically in smaller communities, there seems to be some confusion about who is going to enforce the physical distancing rules and those orders. How much of a concern is that kind of behavior still, and how will you get that message across?
Yeah, these are challenging because people don't always know the circumstances of their neighbors. And there may be different messages that people have received at the airport as well, which we've heard. So part of what we're doing is trying to make sure that what is provided to everybody, particularly now that the federal government has invoked the Quarantine Act to issue quarantine orders on every single person coming across the border. It makes it clearer. However, what makes it more complicated is federal orders are enforceable by the federal police force, by the RCMP. So it has been a bit of a process to understand how that is operationalized across the country. And our E-Division is working with the Public Health Agency and the Canadian Border Service Agency to ensure that that can happen here in BC. In the meantime, the provincial orders are, we have a compliance and enforcement guideline that now should be helpful for communities across the province, and how where people can complain, what's the type of things that can happen and how they can be enforced. So our our way of approaching this in public health is to ensure that people know what is expected of them, and that's the first thing. And most of the cases that we have been involved in that have been investigated, either from public health or from bylaw officers, it's people not understanding and not being very clear about what exactly is expected of them. So that's step number one, and for the most part, when we do that, people are compliant. And that's the approach that we recommend taking. The federal quarantine order can be accompanied by fines and other things. But that would be through RCMP and the federal federal quarantine service. So yes, it's complicated, and operationalizing it is not a simple thing. We're trying to, for the most part, though, I know that people are doing the right thing. And particularly, they're doing the right thing to protect their own families and their own communities.
Keith Baldry, Global News.
Hi, Dr. Henry. Just a number of people have sent me emails saying that everybody's keeping track of statistics right now, and just noticing the number of tests the last 3 days posted on the CDC website has been lower than it has been in previous days, and you've always talked about always changing and evolving your testing strategy as circumstances warrant. So I'm just wondering, is that reflective of a slightly different approach?
It's not a different approach so much. It reflects is that if you look at the number of tests has gone down a bit, our capacity for testing has gone up, but our strategy, as we've been talking about, is about identifying outbreaks in the community, identifying healthcare workers, and part of the reason why it has gone down is because we've essentially saturated the healthcare worker testing. So in particular in Vancouver Coastal, where there was a lot of testing being done of healthcare workers who had symptoms, particularly people who were involved in long-term care, that has come down somewhat because people have been tested and there's not as much people with symptoms at the moment. So it's a little bit of a reflection of the situation we're in. It's also, if we look at the percentage positive, that has gone up, which tells me we are testing the people who are most at risk. So I do expect, though, and I mentioned this yesterday, we are looking at how we can do a bit more broader surveillance in communities around the province and make sure that we have a strategy and by surveillance I mean doing testing of samples that are coming in for other reasons. So we're working on that strategy over the coming days, and we need to make sure that we do have the capacity to respond quickly when we have outbreaks, and we need to do lots of testing around a cluster, which has happened a couple of times in the last few weeks.
Next is Marcella Bernardo, News 1130.
Hi, this is actually a question for Health Minister Adrian Dix. Yesterday you expressed some frustration about travelers coming back with the virus and possibly spreading it to other people in BC. You hinted to that again today. Do you believe that enough is being done at airports to screen people to make sure that whether they're getting on a plane or coming off a plane, once they're in the community, they're not spreading this virus to others?
So first of all, I think we can do better. And we've had these discussions now with the federal government at airports and at border crossings to do more. And they've clearly indicated that they're going to, and I think that's a good thing. We need to enforce, and the federal government needs to enforce the Quarantine Act. Dr. Henry went through in detail how that works. So those are the first sets of things. So yes, we need to do better. We need to do better both at the major airport, which is YVR, where flights are coming in from all over the place, and then from regional airports where flights are still coming in as well. Absolutely, we need to do better at a governmental level. But let's be clear, and especially, this is especially clear now, the Government of Canada and Foreign Affairs Canada is going through an extraordinary process to help Canadians to come home. And there is no excuse. The excuse of whether people were adequately contacted at the airport or not is not an excuse for people not to comply with the order. They have to self-isolate for 14 days when they come back from outside of the province. And this is of the country, and this is especially true in these times where such enormous efforts are being made by the Government of Canada to help people come home, setting up a series of flights, many flights that are going to bring people back to Canada from all around the globe. And whether you're whatever country in the world you're coming from, that obligation has to be absolute, it has to be clear, and it has to be followed. And there is no excuse not to follow it by anybody. We have another, and Dr. Henry referred to this, we're going to have another return, which is mostly not to British Columbia, but to other jurisdictions, of people from a cruise ship, we believe. And the Government of Canada, again, has engaged in extraordinary efforts to help Canadians abroad to come home. But in that case, as in all others, the expectation has to be high. And so, yes, I think we have to do better. And yes, I think the Government of Canada is committed to doing better, especially at the border, and I'm very appreciative of their response to that. But as well, there's an individual and personal responsibility of every single person who's coming back from outside the country to follow the orders of the provincial health officer, to follow the orders of the Government of Canada, and to, as I say, act in a way that is consistent with love for community, love for family, and love for everything else. And that means staying safe for 14 days when you come home.
Next question, Jane Side, North Shore News.
Yes, hi, Dr. Henry and Minister Dix. I have a question about the long-term care facilities and the regulations that you're putting in place to prevent workers from basically moving between facilities and having them all in one place. It seems that you've spoken about this a few different times over the past week to 10 days, and I'm just wondering what state that's actually in now, and if there has been a time during this outbreak, I guess, where you realized that this was an issue, but people were actually workers were still working in these different care facilities, because that's something that we've been hearing about.
And the reality is that this has been a monumental task, and I'll let Minister Dix explain where we are right now. But yes, people are still working at multiple facilities and have been, except for facilities where there are outbreaks. And we know there's quite a few of those, mostly in the all in the lower mainland. So the focus has been, we're talking about 20,000 healthcare workers. So the focus has been on making sure we deal with the outbreak facilities first, and then we have a coordinated plan for around the province. But this came to our attention. Well, it was something we've known for quite some time, and having dealt with outbreaks in facilities, our influenza outbreaks every year, outbreaks that get transmitted when people go between hospital and long-term care. This is something that has been a crisis in the making for many years that we've been aware of. And when Lynn Valley Care Centre outbreak started, that's when we started to consider how can we make this safer for our care homes, and not ensure that the workers who are the healthcare workers in all of these facilities don't lose out. So.
And so, Jane, that's exactly what happened. We have 21 care facilities, and clearly that rule has been imposed in all of those facilities. And now we've been working, and as you can imagine, it's thousands and thousands of healthcare workers that have been affected. So we're working with the affected unions in many cases, most notably the Hospital Employees Union, but others, to ensure that workers, the options are presented to workers in all of those other facilities, and that this be managed in the best possible way, both for the workers and for the facilities. And yes, that takes some time, but so the orders have been automatic in the case of facilities where there are outbreaks, and then we're working through systematically with everybody involved, the other facilities, and that's going to take time, both on the side of the workers and on the side of the people running the facilities. We have a mixed long-term care sector. 1/3 of it is health authority owned and operated, and then the other 2/3 are public beds in private facilities. Those are the roughly 30,000 public beds we have. So we're working through that process systematically to act consistent with the direction we've received from both the provincial health officers and local health officers. This mostly affects, not exclusively affects, but mostly affects Metro Vancouver. And so that's the process we're going through now, and it's a systematic process. At the same time, as Dr. Henry has said, we have been systematically testing and aggressively testing, and you see that results of that in some of the testing we've done, I think, across the board in order to address issues in the sector, changed the way work is done in long-term care facilities, and obviously greatly restricted people visiting the facilities as well, and a series of other steps. So this is a process to protect people in long-term care, and that's what we've been doing systematically. It continues to take time, but I'm very impressed by the cooperation we've received from people on all sides, and we're moving forward with that. And the people we want to speak to most especially are healthcare workers who are doing extraordinary work in long-term care, and we want their position to be respected and to be supported.
Next question comes from Vaughn Palmer, the Vancouver Sun. Go ahead.
Minister Dix, you said earlier this week that the many people who've had their scheduled surgeries canceled, that the government hasn't forgotten them and it will try to deal with that when it can. Do you have a rough estimate of how many scheduled surgeries have been canceled? And when it comes time to clear the backlog, can you see enlisting the private clinics to help erase the backlog?
Well, three things. One, I'll get you a specific answer for tomorrow, Vaughn, if that's okay. So, I have a rough idea, but I'll try and give you as specific an answer as I can in terms of canceled surgeries over the first weeks of this. Secondly, one of the things that we've done is engaged a highly respected health administrator and leader, Michael Marchbank, to assist us in the planning already for what will happen when we resume scheduled surgeries, because that will be a very significant task for everyone involved. Thirdly, we already involve private clinics. I think public surgeries, publicly paid surgeries, 100% in private clinics. I think there was an increase in those last year as part of our plan, and we're continuing to work with those. It's consistent with the Canada Health Act. It's consistent with what we want to do. And so there's no question of that clinics will be part of that in the future, as they are now, in order to do what we can to deal with the backlog. So all of those things, I think, are things we have to do. We have to have as comprehensive a plan to deal with this as we do with COVID-19, because it affects a lot of people in British Columbia, and it's something I think everybody in BC, everybody whose family is involved, everybody who works in this area, and certainly me, care a lot about.
Shannon Waters, BC Today.
Hi, this is a question for both of you. I spoke with the BC Nurses Union this week, and they're extremely concerned about the way particularly N95 masks are currently being used in both acute care and long-term care facilities. For acute care, that includes nurses who are caring for people who are confirmed to have COVID-19, some of whom are being given a single mask for an entire 12-hour shift, some of whom are being told to put masks in Tupperware and reuse them. The Nurses Union says they haven't been able to get any information from the province as to, one, what the state of the supply is, and another concern is how or what information the province is using when it's rationing this PPE, and what they know about how effective it might be, given that just a few weeks ago, using the masks in this way would have been considered inappropriate and possibly dangerous for both the patients and the care providers.
Yeah, so this is obviously something that has evolved and something that we've paid a lot of attention to, and I've had discussions with all of the union leaders about where we're going and why. And firstly, I'll refer you to a document I mentioned yesterday, which is the ethical framework for allocation of PPE. And it goes through the thinking and the rationale and the why we've done what we've done. So it is in times of need that you need to make these decisions, and you need to do it in a way that's safe for everybody. And it is, and I've mentioned this before, it is a change in the way we've thought about how we wear personal protective equipment. And it's for two reasons. One is to protect, of course, the healthcare workers, but it's also how do we best protect our patients, because we know in long-term care, we know in the hospital setting that it can be unrecognized illness in a healthcare worker as well that transmits to patients in those settings. So we have done a reorganization of how people are cared for in the acute care sector and in long-term care homes, but particularly in acute care. So things like cohorting. So these are all well-recognized infection prevention and control practices that allow us to spare the amount of personal protective equipment people need. So when you have patients that are scattered throughout a hospital, for example, or a facility, you have to change your personal protective equipment every time you go in and out of the room between a patient, because you don't want to deal with somebody with COVID or with something else like a methicillin-resistant Staph aureus, for example, and then you go to the next person and you have to put it back on again. So, and we know that every time we put on or take off our personal protective equipment, we're likely to contaminate ourselves. So the rationale is for safety of the healthcare workers, for safety of the patients, and also to spare us the amount of PPE. And I mentioned a couple of weeks ago that the burn rate, the number of respirators, for example, that were being used per patient with COVID-19 was astronomical, and we went through a huge amount of those respirators. And we've talked about this. There is a shortage globally around respirators, around medical masks, and that's important that we need to preserve those for our healthcare workers. So it is absolutely safe to be wearing one face mask, so a surgical mask, and eye protection and visors are the most common, face shields are the most common ones we're using, gowns and gloves for a whole cohort of patients. So if I'm dealing on the COVID-19 ward, then I can wear it for the entirety of my shift unless it gets splashed or dirty or damaged. And that is a well-recognized safe way of using personal protective equipment. It reduces the amount of time I might contaminate myself by taking things off and on. So it is something that is within the guidance that we have internationally and nationally, and certainly it's what they're doing in the United States, in the WHO guidance as well. But I would refer you to the document that we've put out that lays out exactly why and when we would do different strategies, and and the ethical principles behind it. That we are adhering to in rolling out these strategies at this point. In terms of the amount of PPE, it's a moving target, but I can assure you, and I know the Minister can as well, that we are doing everything. There are many innovative things that are happening. We're looking at ways, and there's studies that have come out of both the U.S. and the WHO about repurposing and reprocessing, we call it, but cleaning, essentially sterilizing respirators and using them more than once. We're not doing that yet, but we are investigating to make sure that that could be available if we needed to, if we got to the point where we weren't able to get any respirators and we know that that would put people at risk. So there are many different things that we're looking at across the province. Businesses are stepping up to help. I mean, there's 3D printing businesses that are looking at, that are working with us around visors, not visors, face shields that can be used in the healthcare setting. So there's many innovative things, and I think we have to be that way right now. If we look around the world, everybody is trying to get the same equipment, and we are very thankful that recently, just today, I guess, I don't know if you want to talk to what's happening. We got a plane load of masks in earlier this week, which is great, medical masks, and we have some respirators that are on their way now. Plane actually landed in Canada, but I can't stress enough how challenging it has been to source the equipment that we need. And it's on a day-by-day basis. We have a whole team at the ministry as part of our emergency response that has been looking at the logistics of this from January, because we knew back then that this might be an issue. And they are across all of the health authorities on a day-by-day basis trying to understand exactly how much is where. And we know right now we're okay. There was a period of time where we were using a lot, that we had only a few days supply left, and we let you know that. So it's changing day by day right now. Our colleagues in Quebec are at a point where they're very, very concerned. So hopefully this flight that came in with equipment today will help support them as well.
Okay, we have time for a couple more questions. Binder Sajan, CTV.
Hi there. Minister, you spoke about the number of ER visits going down, and I'm wondering, what is the takeaway from that for you? Does that mean that fewer people are seeing severe outcomes? Does that mean that people are heeding advice to stay home? Does that mean there's less panic? Like, what is your takeaway, I guess, from those numbers?
Those sound like good explanations, for one thing, and this is just obvious that there are fewer cars on the road, there are fewer car accidents, for example. So fewer people are going to emergency rooms because they're staying home perhaps for things they might have considered going to the emergency room before. We've increased the amount of virtual care. I just wanted to congratulate the people at 811. I think yesterday their wait times were under a minute, and people are using virtual care and virtual facilities more. That's just to say that this is a moment, though, and I think the important thing to remember about this is that this is just a moment in time, and it's a moment where I want to just express again our support for our healthcare workers. We have 4,200 available empty beds in our acute care hospitals. That doesn't mean people are working hard. In fact, we are repurposing those hospitals now to prepare for COVID-19. People are learning to do things that they haven't done in a while in the acute care setting, and we're prepared, and we made that decision, I think, at the right moment, but at great cost. But that is, you can imagine, in hospitals that are used to operating at 103%, a difficult challenge. Well, we have fewer ambulance calls. I think on average, there's in March before the ramp up of information around COVID-19, there were about 1,540 calls. That's dropped to 1,260, but there are more calls with respect to influenza-like conditions as people call ambulance paramedics who are doing difficult and important work. The front line often of healthcare is our emergency rooms. And even though there are fewer cases, obviously the level of stress is high, and the extraordinary work done by people who work in emergency rooms continues. So I think that reflects what's going on in society, but it's just a moment in time as we prepare our acute care sector to ensure that we have the resources in place to support people who will need hospitalization as a result of COVID-19. We showed you what the numbers were last Friday. We laid out what our projections were. But the reality of those projections, the reality of them, is that we are refashioning our acute care hospitals, and all of the people involved are doing an extraordinary part in that. And that process has been led by doctors and nurses and people in healthcare who are doing extraordinary work to prepare for this. So that's the work that's being done now. There's cost to it, but that's what you're seeing in the acute care system.
We have time for one more question, but just as a reminder, for any reporters that didn't get to ask a question today, there will be a statement released later this afternoon with all of the information covered in today's avail. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. And our last question today comes from Natalie Pearson from Bloomberg.
Hi, I wanted to ask a little bit more about the rate of hospitalizations in ICU, people in ICU in BC. I don't mean to imply that to minimize the gravity of what's happening out there, but it would seem that the pace of people going into ICU and the pace of people becoming hospitalized here seems lower than in some other geographies. And I'm wondering if that's accurate, and if so, if there's a reason for that.
It's definitely accurate, and you know the one thing that we do know is the severe cases, the hospitalizations, the people in critical care around the province, and we're confident in those numbers. And we don't want to jinx ourselves by saying this, but you know this is, I believe, a factor of the fact that we put in quite stringent restrictions quite early as we started to see the numbers of cases being in our community increasing. This is our flattening of our curve, and we are hopeful that that will continue, but we can't take our foot off the pedal yet. You know, we can't. Our rate of hospitalization is about what we would expect. It's about 16 to 20% overall. Early on, we had a very low threshold for bringing in people into hospital, even if they might be, because we had very few cases, even if they might not have needed hospital care. We're now at the point where people who need hospital care are getting it, and we have a process as well with our critical care physicians so that people are getting ventilated early if need be, and we know that that has reduced hospital stay and improved people's outcomes. So all of those things in place, we are in the middle of our critical week and weeks right now. So we are hopeful that it will continue to be a slow, steady pace, and that we'll be able to manage it and care for everybody that needs it, both for COVID-19, but also everybody else who needs our healthcare system at this point.
That's all the time we have today. Thank you, everyone. Thank you.